Let's dive in the details of possible treatment strategies depending upon the cause of pleural effusion, which include antibiotics, thoracentesis, tube thoracostomy, pleural drain, pleurodesis, and pleural decortication. Let's learn about them one by one. Antibiotics are administered to treat underlying infections of lungs, such as pneumonia, or diuretics are given for congestive heart failure. We can go for radiotherapy and chemotherapy in lungs tumor or cancer. Next is thoracentesis. In this procedure, pleural fluid is removed from lungs by inserting a needle into the chest cavity and suctioning the fluid into a syringe. This is used to get rid of excess fluid as well as to diagnose type of fluid and its cause. In case of large effusion, more fluid is extracted to ease patient symptoms. There is another term called thoracoscopy, which is a surgical procedure that let the doctor examine inside of the chest cavity using a fiber optic camera. A few small incisions are made in the chest area under general anesthesia. After that, a thin and flexible tube with a light and a small video camera at one end is inserted through one incision and a surgical tool through the other to extract a fluid or tissue sample for analysis. Another strategy is tube thoracostomy. It is done by making small cuts in the chest wall and a plastic tube is inserted into the pleural space for several days. If the pleural effusions are continually coming back, then a long-term solution is needed. So, pleural drain is performed. A long-term catheter is inserted through skin into the pleural space. That's how pleural fluid can be drained at home. Let's have a glance over pleurodesis. It is basically done to close the space for effusions by adhesion of pleura. It can be done chemically or surgically. In chemical pleurodesis, after drying excess fluid out of the chest cavity, an irritating substance such as talc mixture, tetracycline, or povidone iodine is injected through the chest tube into the pleural space to induce inflammation between lung and chest cavity pleura. This substance causes the pleural membrane to stick together, which prevents recurrent pleural effusions. While in surgical pleurodesis, effusions are drained and then pleural membranes are irritated mechanically through thoracotomy or thoracoscopy. Do you know the difference between the two? Well, let me tell you. Thoracotomy is a surgery that makes an incision to get access to chest, while thoracoscopy is a minimal invasive procedure to visualize the pleura. Last resort is pleural decortication. Surgeons can operate inside the pleural space, removing potentially dangerous inflammation and unhealthy tissue. Infection or bleeding are some complications of these surgical procedures. Doctor will help to determine the most effective treatment strategy and the pros and cons of it. That was all about pleural effusion. Thank you and keep watching sqadia.com.